Joe Henehan, and he's setting up. You can't talk about such a complicated topic like Obamacare and expect it to not come with some slideshows and materials. So, okay, so you're about, all right, so before Joe comes up, do you remember Nancy Pelosi's famous quote, "But we have to pass the bill so you can find out what's in it." And then she had that little irritating laugh that gives psycho girlfriends a bad name. So it's me. Anyway, our next speaker is Joe Henehan, and he's such an expert in Obamacare that he knew what was in that 20,000-page bill even before the Democrats passed it in the middle of the night. Joe is a widely quoted expert. He's often quoted in the local media, especially The Sun and the Facts, and he's been speaking about Obamacare for years. He founded the Henehan Company in 1985. He's a good friend of mine as well as a staunch conservative, and he's generously giving his time to us. Unfortunately for us, I didn't have to go far to ask him because we are both active members of the same church at First Congregational. Obamacare is a complicated topic, so we've allotted 45 minutes to him with 15 minutes for question and answer immediately after that. If you have a question, please get right to the point. Also, if you have a side conversation, because you know people in back want to hear, please go outside or go to the back of the room. So, with that, you need a couple more minutes. I like how even the Democrats are running from Obamacare now. I think that's why they ran Max Baucus out of the Senate, is that he actually stood up and said, this is a train wreck coming, you know. Even, I like the Pew poll that came out a few days ago that 42% of Americans don't even know that Obamacare is the law of the land. I thought that was the scariest stat since Obamacare's fading. About the only person defending Obamacare now is Sebelius and Obama themselves, because none of the Democrats are. I personally think Obamacare is about to become Obama's Vietnam. So, maybe so. Your mouth is not here. I think he's listening. You know, he's listening. This is the third time I've heard Joe's talk. He's got materials. I want to thank Joe Henehan very much for coming up here and talking about Obamacare. Thank you.
I am going to grab the mic if it's portable. It may not be. This is a great group. Let's see here. January of 2009, when the Democrats were in control of the House and the Senate, we'd been monitoring healthcare reform for years in California, but also on the federal level. And so March 23rd, can you hear me okay? No. No. How about now? Better. I'll start over. There we go. Alrighty, so back in December of 2009, when the Democrats had control of the House and the Senate, we had been monitoring healthcare law in California for the previous 10 years because, again, in California we had a very liberal legislator. And they had been promoting again and again and again, and what we know about the far left is that they never give up. They may lose temporarily, but they will always come back, and we need the same result. So March 23rd, 2010 is when the Patient Protection Accountable Care Act was passed. And literally, no one knew what was in it, literally. Therefore, Nancy Pelosi's famous statement. The Republicans had actually drafted real healthcare reform legislation, had put it into the hopper. And there's a literal hopper, I'm told. You open it up, you put it in the hopper, and it's the actual bill. It never got out of the hopper. They never looked at it, never got to the committee. And even the Democrats didn't know what was in it. So I want to start, though, with the perspective of how it affects employers, large companies and small companies, and therefore how it's going to affect employees. So I'm going to do a little primer. And Susie, my wife, raise your hand back there, sweetheart, thank you. Would you let me know every 15 minutes by raising your hands, going, hurry up, you're going too long. All right. So I want to take it from an employer's perspective. At first, okay, how is our, well, you know, turning it on where it shows green would certainly be helpful. There you go. Follow the instructions. Usually it works. So healthcare financing, just to show you the primer, some of this may be old hat, but others it's like, well, how does this really work in terms of healthcare? I am not a medical professional. My training and background is in insurance and risk management. But I wanted to explain how healthcare and health insurance relate. Healthcare is what the cost of healthcare is what drives the cost of health insurance premiums. So when you have a patient, they usually go to a medical provider. They go to a doctor, they go to a hospital, they go to a surgeon, a pharmacy, a physical therapist, an occupational therapist, all kinds of different medical care. How many of you served in World War II? Anybody here that served in World War II? Anybody have a father or grandfather that served in World War II? Okay. The past president of the American Medical Association spoke at a conference 6-7 years ago, and he was in his late 70s, and he said, when I was a young physician, stand by, he said, when I was a young physician, we didn't have very much medicine. In 1948, there was penicillin. So X times Y equals Z. That's a simple algebraic equation. X was the amount of medicine that they had in 1940. It was very small. Doctors could set bones, but the prescriptions were virtually non-existent. So you have X amount of medicine times Y, the cost, equals Z, the total cost. How much medicine do we have today? We have that much medicine. Gigantic improvements. What is the cost per unit of that medicine? Some of it's come down. Some of it's come way down, but some of it's still very expensive. So X, a big X, times a big Y is a huge Z. So you have more health care. And they say, well, why do we spend so much money in this country on health care as compared to the rest of the world? Because we can still choose to do it. We have a choice. Where they've limited health care, you can only buy a limited quantity of it. In America, we still do that. One of the other fallacies is they say, well, our mortality rate is 37th in the world. Oh my goodness, that's horrible. And you go, well, compared to what? It's always, what do you have in context? If you only see this much, well, that's got to be true. You go, no, the context is this big. So what was just told to you is a big fat lie. So here's what happens. Life expectancy in the United States is about 78 years old. We're 37th in the world. What do you think the highest life expectancy is? It's 81. It's a whopping 3 years. That's it. Now, if our life expectancy was 45 years of age, and the highest was 81, you go, this is a problem. But we're also not a homogeneous population. We have lots of different people groups in this country. Japanese women don't die. Okay? How many old Japanese women do you know? Lots. You know where the largest population of Japanese women is outside of Japan? Canada. Okay, so again, the context. So with that, you go to a medical provider, and the medical provider gives you treatment. How many of you have been to a doctor in the last year? Okay. How many of you had a prescription in the last year? You've gone to them, they've given you a service, they're giving you a treatment of some sort. Then you have the insurance company in many cases. The medical provider sends the bill to the insurance company. The insurance company sends money to the provider. Now many providers would say, they don't pay us enough. Okay? You can argue both sides. An insurance company has what's called a contract. we promise to pay for this in our plan. Well, how come you didn't pay for the $3.5 million special treatment that we could possibly use? You go, well, it's not in our contract. So there are exceptions that insurance companies will make this, you know what, we will pay this. But if you have a contract, how many of you are in business? And you have a contract, I will build you this for this price. And they go, okay, but they go, by the way, we want to have a gold plated. You go, that's not part of the price. But if it's part of the price, I can charge you for that. So now you have an employer. And the employer will pay a premium if you're covered through an employer. Remember, the context of this talk is on how healthcare reform is affecting employers, and then we'll also talk about employees. The employer pays a premium to the insurance company, and a percentage of that premium, the patient or the employee may pay for his or her health care. Now what I have here is what's called the 3 blind mice. Anybody remember that? 3 blind mice, right? I'm not Frank Sinatra. And you go, earthquake, we can tell. But the 3 blind mice, in many cases, are the patient, because what the patient thinks the cost is their copay. You go to the pharmacy and you have a $5 or $10, $15, $25 copay, and you think that's what it costs. Or you go to the physician and you have a copay of $15, $25, $35. That's not what it costs. It's significantly higher. An office visit realistically low is between $40 and $120 for a basic visit to see the doctor for 10 or 15 minutes. You go, well, that's not very much time. You go, yeah, but look at all the overhead. You've got the nurse, you've got the office, you've got the malpractice insurance, all those things. And by the way, many times physicians are forced to over-prescribe things to cover their pail. They don't want to get sued. Okay? Okay. We're going to play a game here. No portable mics, right? Hold on one second. We're gonna play insurance company and insureds, and here's how it works. Who would like to pay a premium? We're gonna let Marilyn pay a premium. John pass out some premiums. You say $1 on them, it should say about $300 a month. But here's a bunch of premiums. Kind of pass them around. We're gonna learn how insurance works. If you want to do those, that'd be great. Okay. They're glossy too, so. Okay. All right. So how many of you now have a premium? All right. This is how insurance works. Everybody pays a little bit to the pool. Because I can't afford a $200,000 hospital stay with a surgery, or $300,000 hospital stay, but I can afford to pay a little bit and share the risk of the entire room. Okay, you now have premiums, right? Okay, we want John to stand up and Marilyn to stand up. And now I want a couple of volunteers to collect those premiums from everybody and pay them to John. He's going to be the big bad insurance company. Okay, Marilyn's going to help. So we're going to collect them all. You're paying your premiums every month to the insurance company. You're the mail. Right now you'll be the mail service, but John's going to be the insurance company. Sorry. Okay. Everybody got their premiums into John? All right. So what we have up here is the money. Everybody turn their premiums back in. Hurry. You'll get a late notice. 30 days to reinstate your coverage. Oh, I lost it in the mail. No, that's okay. We need it anyway. Yeah, John's going to pass around here in a minute cards, so if you have questions for me at the end, you can ask me questions. Okay, so you have now collected all the premium, right? John's got a lot of money as an insurance company, right? Okay, now here's what happens. 85% of that dollar pays claims to the doctor, to the hospital, to the nurse, to the anesthesiologist, to the pharmacy, and all those things. So John, bring one of those bills up for me. Okay, hold the mic up to my face if you would, right there. Okay, so we have $1 in premium, right? So now what we're going to do is we're going to cut 85% of that, and John's going to go and pay a bunch of providers out there. So John, go ahead and go find a doctor or a hospital or a pharmacist, and you're going to get paid. Remember that diagram? You bill the insurance company, and then the insurance company pays you for your services rendered. So 85%, generally speaking, of every dollar that's collected goes out in people getting their claims paid for medical. All right. What happens next? Does the insurance company have any overhead? It has rent. It's got to pay its people. It's got, I'm ahead of myself. These are the claims. So you're paying money out to a hospital, to medical providers for equipment, that's an MRI machine, and pharmacists. So you got to pay out the money. Then you have overhead. Anybody have a small company or a big company? Anybody have employees? Raise your hand. Do they work for free? Of course not. Do you get to pay your rent when you feel like it? No. If you don't pay your phone bill, they shut you off. So you have 10% goes into overhead. You've got your building, your pay. Now this is money falling from heaven, employees reaching for money. But you've got rent and all the stuff, so you've got 10% in overhead. Okay, John, come on back. This is what's left right now, 15%, right? Okay, hold on. Okay, John, take that piece and go pay the rent to some people, go pay your employees, and go pay the phone bill. Okay, how much do you have less? What's 85 plus 10? 85 plus 10 is how much? 95. So you've spent 95% of your money already. What do you think's left? Taxes. You got to pay your taxes first. All right, so here's my tax. All right, John, go find some elected official and give it to them. Okay? It's not enough. We need more taxes. All right, so what's left? Oh, I forgot that slide. Uncle Sam and Uncle Jerry. Sorry. State and federal taxes. And what's left is profit. And you see those tiny little dollar signs and plus or minus? If you have a bad year, you may not have any profit. So this explains delivery of the health care, and then it explains the financing. And health insurance is no more than the financing of the health care. That's it. Medicare is a single-payer system already. The federal government reimburses to Medicare providers. It's a single payer. Medicare reimbursements are very low. The physicians in the office, in the audience will tell you, they will go broke if they only have Medicare patients. Very low reimbursement, very low efficiency. All right, so this is the backdrop of how it works. So you can say, okay, I understand the logistics. John, can you bring me up one more premium that hasn't been spent yet? Okay. Hold the mic for me. Okay, so here's what happens. Right now we've been told we have to cover this much. When the government tells you you've got to cover more things, can I still charge $1? No. If I have to cover this much, and you see that kind of growing? If this is what we're told we must cover, literally, I can't charge $1 anymore for the premium. I'll be bankrupt as an insurance company. Because these are mandated benefits. How many of you had a Ferrari as your first car when you were in high school? There could be somebody. There could be. I got, my mom and dad's first car was a Plymouth 4-door, and it was made of like solid steel. And it had punch buttons for the shifter. Anybody have one of those? Yeah. Yeah, they were, you know. Did it have air conditioning? Did it have power steering? You had a biceps 18 inches big to turn it. You know, and the women had to put their foot up and go like that to make it turn. No power steering, power brakes, power windows, bling tires, bling rims, heated seats, sunroof, DVDs in the back that help your unruly kids be quiet. Shut up while I'm driving. Okay? All this stuff is required. In the old days, you could say, I'd like a choice, I'd like a spectrum, and so I put it in the automobile deal. You're forced to buy a fully loaded Camry. How much is a fully loaded Camry? How much? 30,000, 26, 30 grand. How much is a really nice Kia that has 8 airbags? Very good. 8 airbags safe, even has air conditioning. You can buy a used one for $8,000 or $9,000. It works really well to get you to the hospital, to get you to school, to get you to work. It was safe, but they said you can't offer a low-end coverage and pay less for it. Big deductibles, bigger out-of-pockets. You can't buy this. So they took it and said you can't buy the lower-end stuff. You can't buy this, you can't buy this, you can't buy this, you can't buy this. You have to buy the comparable, what I call fully loaded Camry. Can everybody afford a brand new fully loaded Camry? No. So can everybody who's buying insurance afford the rich plans that are now mandated? No. Wasn't the goal to get more people insured? Yes. But when you raise the price of it, people can't afford it. So the exact opposite takes place. The exact opposite takes place. Fewer people are insured because of the healthcare law. And fewer people will be insured because of the healthcare law. All right, so now we go back to the goal was to reduce the increase of your healthcare premium and reduce the healthcare cost. You can do it a couple of ways. The premiums are high because the cost of healthcare is high and what's mandated. Healthcare costs can be decreased by lowering these drivers. And what they are, generally speaking, we have aging, first 15 minutes or second 15 minutes? First. Okay, I'm 1/3 of the way done. Poor health. Generally speaking, we're overweight and we eat bad food. Generally speaking, look at my profile. See, I'm a classic example of this. People say, well, you don't look fat. I'm fat. Okay. I need to lose 20 pounds. My wife is an exercise physiologist. She's been telling me for 35 years, Joe, you need to exercise more and eat better. Is that right? Yes. Okay. Aging population. We can do nothing about that except have our grandchildren and children have more children. Okay? Tell them they have more kids because the birth rate's declining. We need to have more kids. Overutilization. People go to the doctor when they don't need to. Why? Many times it's because it's a low copay, and sometimes they just need to go see the doctor as their quasi-shrink. They need somebody to talk to, and that's okay. Quantity of medicine. Remember my X times Y times Z? Remember that? It's like YMCA. Okay? It's the X amount of what we have times the Y cost times that is a huge Z. Lack of transparency. The patient, the 3 blind mice, do not know what it costs. And there's a tough, it's improving, but you can say, well, I'd like to get an MRI. Someone might charge $800, someone might charge $1,500. Why? It may be the identical procedure or it may not. So there's always the context. Third-party payers involvement. Remember that diagram where the insurance company pays the provider? The patient rarely writes the check for the whole amount. Some of you probably have high deductible health plans with health savings accounts. Those of you that have that, you know what it costs for the total deal. Prescriptions could be $25 or $150, but you know what it costs because you're paying all of it first until you hit your deductible. Litigation. Don't answer this. How many of you have been sued? Don't answer that, don't raise your hand. But several of you have been sued in this audience. Probably fallaciously. Tort reform. When you look here, wellness, transparency, technology to make things quicker and more efficient so that you know the right drug to prescribe. You've got coordination of the care between the 3 or 4 physicians that are giving you care and they're speaking to each other. But tort reform is doctors being sued fallaciously or insurance companies being sued fallaciously. So I have a friend, I have a person I know, she used to work for a person who's in Congress who is a physician. And the comment was, this physician said, you know, I usually can pretty much diagnose what needs to be done with probably 2 tests, maybe 3. But many times I order 5 or 6 or 7 so that I cover my tail, so I won't, if I get sued, I can say, well, I already told you. So because of that, there's overutilization. Okay. Drivers of reform. Healthcare costs increased, as therefore health insurance costs increased, and we have the uninsured. The initial goals of the reform were to lower the costs in healthcare, assure the quality of healthcare, have affordable coverage for all Americans, and choice of doctors. It was a great political campaign. You can keep what you have. Healthcare costs will go down by $2,500. Exact opposite happened. It went up. The healthcare reform law, when it was being done, the details were hard to come by. They were virtually, you couldn't see them. Mostly general provisions. There were some basic timelines which have become now very specific, and it's still being written. The original law was about 1,700 pages with amendments that were back and forth 2,200. There's about 20,000 pages now. Health and Human Services, HHS, Health and Human Services, reports to the President. You have the executive branch of the United States government, the President, and he has his cabinet secretaries, one of which is Health and Human Services, which also is CMS, Centers for Medicaid and Medicare. That's Social Security and Medicare. And so HHS oversees this implementation. Employers across America want to know, what are the effects on me as an employer? What are the effects on my employees? How much is it going to cost me, and what do I have to do? There is a broad range of information that people have heard, and they're going, oh, does this apply to me as a business owner? The positives of the law, notice it's in quotes. I have to say something else, okay? A small business tax credit, there were supposed to be 4.3 million businesses take advantage of this. There's been less than, I think it's less than 300,000. And the reason it's so convoluted, and many small businesses don't qualify. What it is, as a small business, if you have fewer than 25 employees, and you pay a percentage of the person's employee's premium, and as long as the average payroll for the entire company is less than $50,000 per person, and you hop on one leg, scratch your head, and put your hand behind your back, you can get a tax credit. But if you have more than 10 employees, the credit starts declining, and you get less and less credit. It's completely screwy. About 1 in 3, for about 3% of it, has actually worked. Employers have thrown up their hands and said, by the way, it doesn't, I don't qualify, or it's so little that it's not worth the effort. And they don't give you the credit monthly. You file your tax return, you get it at the end of the year. So you go, well, let's see, I got to fork out the money, and then you get the money at the end of the year. Overage children. You can be up to age 26, used to be 18 to 22, depending if you're in college. So you can be a child on your parents' health plan until age 26. Probably not a bad idea, because there are a lot of unemployed people between 18 and 26 that can't find jobs, and they can still be covered. They go, don't move back in. Okay? Sometimes they have to. But you can have a married son or daughter who's employed. They can still have coverage underneath you as a parent. Guarantee issue. Guarantee issue means this. Prior to the change coming 1/1/14, if I had cancer or I had a serious heart problem, I was a bad risk. And if you have 5 or 6 car accidents, is your insurance rate like everybody else's? That's higher. No. You have to look at what the risk is, and you say, that's not a big risk, or it's a big risk. I have to charge you accordingly. Well, guarantee issue in health insurance for individuals, people that buy individual policies, not through group insurance. It's like buying fire insurance after the fire and the house burned down last night. I can still buy insurance within a window, even if I'm horribly, horribly ill or sick. What does that mean? If I'm healthy, I don't need to buy it. But if I'm unhealthy, I'll buy it. So what happens to the young kids? They go, I don't need to buy this, I'm healthy. The pool shrinks. We want a big pool. We want a lot of healthy people and some sick people. And you may be really healthy today, and next week you may be really unhealthy. But you don't know, so you have the risk of the pool spread around. Well, that's going away in January of 2014. An insurance company will have to offer you coverage regardless of your health. And someone would say, well, they should. You go, well, why should they? They will lose their shorts. Now, the flip side of that was you have to buy coverage. Remember the Supreme Court? And the law said, well, is this really a penalty? And the Chief Justice said, no, it's a tax. If it's a tax, it's not unconstitutional. And it said you've got to buy coverage. So if everybody was forced to buy it and everybody bought it, you'd have a bunch of healthy people and some unhealthy people, and then guarantee issue would work. They were supposed to work hand in hand. Guarantee issue, no matter what, but everybody's got to buy it. How many of you think everybody's going to buy it? So you missed the other half of the equation. So you've got all the expense that's going to come, and you're going to have fewer people buying it. Numerator divided by denominator, okay? For arithmetic, I always told my kids, if you can add and subtract, divide and multiply, do fractions, percentages, you can conquer the world. It's been, you know, when you look at what we do in our daily lives, you know those well. You can do fine. So numerator is the top number in a fraction, right? Okay? Denominator is the bottom number. Denominator are people that buy the coverage. If the denominator is this big and the numerator is this big, cost per unit is low. The denominator is shrinking. It's becoming a smaller number. The numerator is staying the same and going up. The cost will go up in the fraction. So the guarantee issue portion is the law. How much is the penalty if you don't buy health insurance? It's 1% or $95 a year. 1% of your wages. So you take a 20-something person that makes $25,000 a year, and they go, let me think real hard. 1% of $2,500 is, $25,000 is $250 or $95. The health insurance premium before the law changes for a single person is $150 a month. That's $1,800 a year. Let me think, 1,800, 250. 1,800, it's a non-decision. Find me, if you can find me, okay? On your tax return, it's go, do you have health insurance? Yes. Then you got the health insurance police going to go find out if you did. Okay. So the guarantee issue already existed in group insurance, employer-sponsored health plans. If you had a small company, if you had 2 employees or more, and you applied for the coverage, you got it. They took you. You issued the coverage no matter what. If you had an HMO, your pre-existing conditions, my heart disease, my diabetes, was covered. If I had a PPO, you had to wait 6 months to a year. Okay? It already existed. All the stuff that they wanted already existed in the private marketplace if you wanted to buy it. It was optional. If you didn't want it, you didn't have to buy it. Now they're saying you must. Okay. No lifetime maximum benefits. Second 15 minutes. Thank you. No lifetime maximum benefits means used to be you could have $1 million lifetime maximum benefits. There might be someone in the room that has had more than $1 million in their family or someone they know in claims. In my 30 years of experience of our client base, we've only had one claim, and it was 1.2 million. It was on a premature baby. But after the discounts from the hospital, it was under $1 million. But actually, not many people have claims over $1 million because, unfortunately, if you have that number of claims, you've probably passed away. So the unlimited benefit for your lifetime and the annual items isn't a big cost factor, because that's not really what the amount. Preventative care is covered at 100%. Flexible spending accounts and health savings accounts. How many of you work for an employer where you have a flexible spending account? You can take money pre-tax, put it in for child care, put it in for unreimbursed medical expenses. Those have been changed. HSAs have been changed as well, health savings accounts. This was what was originally part of the law. It got nixed because it was so much outrage. This part of the law said you have to give a 1099 to anybody as a company that you pay more than $600 a year. For those people that have companies, anybody that you paid $600 a year to, vendors, they're going to require a 1099. They go, you got to be kidding me. I mean, that's nuts. How much extra paperwork? That didn't happen. They repealed that. New reporting. If you have more than 50 employees in your company, you are required on your W-2 form to show how much the premium was for that person. Again, regulatory, burdensome, oppressive. Summary benefit comparisons. carriers will have to generate what's called this summary benefit comparison. By the way, if you, the employer, don't give it to your employee within 7 days, they can fine you $100 a day. It's crazy. The Class Act. Someone called it the Unclass Act. This got repealed as well, but this was going to be long-term care, and they were going to charge $120 to $240 per month for people that signed up, no benefits for 5 years, and this was sort of the smoke and mirrors, because all this money that was going to be collected was to offset the cost of the health care reform. No benefits for this long-term care coverage for 5 years, but all the money we collected, see, it really isn't going to cost as much as we've got this extra revenue. That was repealed, so now there's that tax revenue won't be there, but the other costs will, so there won't be any offset. So, and they were, oh, by the way, it was a whopping $75 per day. So for those of you that have parents or grandparents in skilled nursing, you know that the cost is running about $200, $150 to $300 a day for skilled nursing. So $75, no one would buy it. More tax revenue. In 2013, the medical expense contributions was limited to $2,500. Increase in Medicare tax of 0.9%. This was done on folks that made over $200,000 individually and $250,000 jointly. And then this 3.8 Medicare tax on investment income, which means rental income, dividends, interest, sale of houses. Okay? So if your house you bought for $100,000 and you sold it for $350,000, your gain's $250,000. Plus your regular income, you now qualify for being in this category of over $250,000, and you have a 3.8% tax on the sale of your house. No one told you that. And the president said this isn't going to cost anything.
So, this applies to Obamacare tax. If you sell your house for $200,000 for single, then you can charge 3.8 tax.
It depends upon your gain. If you buy, what the gain is, not the sales price, but what the gain is. If you bought it for $100 and you sold it for $350,000, you have $250,000 gain. Not the sales price, it's the gain. Provider compliance. Currently there are 14,000 codes called CPT codes, Common Physician Terminology. So you know when you see your bill and they check the box of what it was? There are now 14 check boxes for mosquito bites. Used to be one. And in 2014 there's 180,000 codes. So for those doctors and hospitals and physicians, they go, you know, on 14,000 you might be able to have a book, you know, and flip through. You can't flip through a book with 180,000. You must be, must be computerized. So think of all the software rewrites that had to happen. Okay, rate changes in 2014. This bottom point here is what's really going to hurt small employers and people that buy individual insurance. Okay, I'm 57. Do I have typically higher healthcare costs than a 27-year-old? Yes. There used to be a 6-to-1 spread from a 60-year-old down to a 30-year-old at various rates. 29-year-olds are pretty cheap. All they do is break their legs snowboarding. That's all they do, right? Or smack their head because they think they're invincible. Yeah, when you're about 45 and you have kids, you go, you know what? Life is very precarious. I get this. So a 60-year-old typically costs about 6 times more in healthcare costs than a 30-year-old. So there was this banding of 6 levels. Now there are 3. The 60-year-old person's rate cannot be any greater than 3 times the rate of the 27-year-old. Claims haven't changed, but the distribution has. So what's going to happen to the young person's rates? They're going to go up. Are they going to pay for it? No. So again, because they think, oh, let's have it fair, and you go, you're going to exacerbate the problem, which they did. Now, there is legislation in D.C. that says, would you please let us go back to 5-to-1? And even Tom Jones, who's the insurance commissioner in California, said, this is a bad idea. And he's a raving, interesting guy who doesn't like private health insurance at all. But this is a problem that's going to hit small employer groups and individuals come January 1. So what you have is now what's going to happen with you. If you have more than 50 employees, if you have a waiting period for your group health insurance, it's now 90 days. Some companies have 120 days, 150 days, 6 months. It's now 90 days. From when? The day you were hired? Well, I hired 3 people this month. I hired one on the 5th, one on the 12th, and one on the 26th. 90 days from that? Not clear. Most people would have coverage starting the 60th day after the first of the month following and got hired. So you're going to see this go down to 60, and the subsidies begin in 2014. Essential benefits. You're going to have what's called required, the bronze plan, silver plan, gold plan, a maximum deductible of $2,000, and variations in and out of the exchange. I'll get to the exchange in a minute. Many people have coverage right now that is less than a 60% plan, and they're quite happy. I go, I like what I have. I don't have to have this level, because I like what I have. Sorry, in a small group market and the individual policy, no choice. What did the president say? You can keep what you have. You can't. I mean, that's a general overstatement, something called the grandfather clause, but most people are not going to be able to keep what they have at the price. Okay, employer mandate. This is the big deal you hear about. Employers have to offer coverage. Well, only if you have more than 50 employees. So if I have 60 employees and I've got 10 of them, I have 15 of them that are part-time, and the other 45 are full-time, I get to do a calculation and find out how many hours they work. And if they work X number of hours, I have an equivalent of 50 employees. So employers are going, I've got 47 employees. I'm not going to hire anybody. Because at 50 or 53 or 4, I will be forced to give it or provide it at this level of 60%. So it'll hurt employment. And employers are going, oh, well, I've got 100 employees. I'll break my company up into 4 companies, 25 apiece. They go, nah. I mean, you think, but no, you can't. That's part of the law. You look at the overall common ownership. Okay, now here's the deal. If I have 50 or more employees, and I do not offer the right kind of coverage that's considered affordable, or I don't offer it at all, then I will be penalized, taxed, beaten, $2,000 for each of my employees. Okay, let's take this example. I have a janitorial company, and we have 400 employees. And we have 35 people that are in management, and we offer a health plan to them. But the other 400 employees, we're paying between $8 and $12 an hour. If they work more than 120 hours a month, or 27 and a half hours a week, not 30 hours a week, I will be required to offer them an affordable plan and make sure they don't pay more than 9.5% of their income for it. And they're going, well, let me think, I can't do that because I can't build into my prices. So I have 400 people, a $2,000 penalty. I have an $800,000 penalty. I'm bankrupt. I'm out of business. And penalties aren't tax deductible. Okay? Think of the fast food. Think of restaurants. Think of again, it hurts the lower people on the totem pole, the economic lower part. You can't discriminate in terms of various plans you offer. I'm going to skip over that. I'm going to skip over this. I'm going to skip over this. Here's one of the triggers. If an employee's portion of premium exceeds 9.5% of the employee's income, it's unaffordable. If you offer a plan that doesn't meet that, and then someone goes to the subject, then it's a $3,000 penalty. Okay? So what's happening is people are going to say, I'm not going to hire full-time employees. We're almost done. Insurers, there's taxes on the insurers in 2014, $12 billion and going up. There's also a $5.25% pass-through starting in 2014. Because of the tax increases, the insurance carriers that can be passed through, not the mandates, they estimate that the cost will go up by $500 a year for people that are covering their families. Exchanges. Have you heard about the exchanges? I'm at my 45-minute point. I have 5 minutes left. Okay. Do you need coffee like I need coffee? Or I have to wake up here? Okay. Talk about this 3.5% fee to insurers in the exchange. Past exchanges in California. The idea was let's have a place run by the state where we can get lots of carriers to come together and we'll offer a variety of plans and we'll have competition. California has one set up. There are approximately 15 to 26 states that have said we're not going to do it what the federal government did so they can screw it up. Health and Human Services issued a ruling about 2 weeks ago that said, oh, by the way, we know this isn't getting done as fast as we should, and rather than having several health insurance companies in the exchange you can buy, we're going to only let you have one the first year because we know you can't get it done in time. Senator Baucus, the senator from, I believe, North Dakota or South Dakota, was the primary pusher of the affordable health care. He told Secretary Sebelius in a Senate hearing last week, he said, Madam Secretary, I see a train wreck here. And he was the guy that sponsored the bill. He's not running for re-election. Yeah. So it is a train wreck. Okay? But these in California, Health Insurance Plan of California was in 1993. Who was governor of the state of California in 1993? Pete Wilson. We had a $12 to $19 million surplus. But even Pete Wilson said, this will be a great way for competition to work. Now, those of us in the industry said, not when it's state-run. So it was taken over by this outfit, and then it closed its doors in 2006. One that was a private one is still thriving. It's supposed to lower health costs, heavy burden, employers' expectations, consider reducing the size of the company, consider reducing the number of employees, considering not hiring additional employees. Will the law change? This is after the election. It's here to stay until we get other guys elected. So it's here, we have to deal with it, but I hope we all get, we go and talk to the people that aren't in the choir. Yeah. We know this stuff, but you got to talk to people that aren't in the choir, nicely informed within context, and say, here's what these guys did, here's what we would do, or these folks would do. You should probably vote for these folks. This is a flow chart. Okay? Penalties. This goes back to how do you figure it out? It's complicated. It took me about 7 or 8 times to read it. And then I thought I got it. And then I talked to Ernst & Young, and I said, oh yeah, I really do get it. But it took me 7 times to read, literally, to read this. You know, if this, then that, then this, then that. On how it's covered. Here's stuff on if you are going to get it through an exchange and subsidies, more junk. Here's this tax credit. You can see it getting smaller up here. Well, you see the number of employees. Okay, it goes down. When you have 25 employees, there's no more tax credits. By the way, the tax credit's only for 2 years. Okay, they're gone, and where they come from? I don't know. Just send more money. And federal poverty level, more information on that. If you're really low income and you buy from the exchange, the federal government's going to send money to the insurance company for your $10,000 a year premium, and you're going to pay about $100 and some odd bucks a year. Well, it's our money as taxpayers. Okay. With that, here are some questions.
First of all, thank you, Joe, very much for that long and informative. And it generated lots and lots of questions. We want to thank him with this new Tea Party coffee cup. So, with coffee, we are that effective. So we got about 15 minutes for questions and answers. I'll hold the mic right up to my...
You want to read them?
Yeah, I'll just read them.
Okay.
Ready?
Will Obamacare grow the...
You just want to read them and do that? Okay. Will Obamacare grow the black market for medical care providers?
Well, we have to define black market, and what this sometimes might be referred to as medical concierge, where... pardon me? Okay. Some physicians in certain areas are saying, look, I'm not going to take your health insurance. You can buy your health insurance for the big stuff. But if you want to pay me $4,000 a year. I'll guarantee you have no waiting lines. You can come and see me. And it's called a medical concierge. As if you can kind of pick what you want. That exists today, and it has existed in the last several years. So in terms of the black market, that's what the meaning is. It wouldn't be, under the table or, back alley type things. That's not what the connotation of black market. But you're going to have some physicians and providers that go, look, we're not taking the insurance anymore. You can buy it for the big stuff, but for the regular stuff, we're not going to process it, we're not going to take it.
A lot of questions on this. Is it too late to repeal Obamacare, and can it be defunded?
No and yes. Okay. I was asked today, we did an employer group for a manufacturing area with 400 employees, and the HR person, human resources, said, well, why doesn't Congress just repeal it? And I said, the House of Representatives did. Okay? The House of Representatives, in fact, voted in their chamber to repeal Obamacare. But you got to have the Senate. So it can be repealed if the House is maintained and you have a super majority in both to repeal it so that the president can't veto it. It's not likely in 2014 to have super majorities in both houses. However, when they wrote the law, they weren't stupid. And one of the people that I know that works on the Hill, she told me, I said, really? She goes, Dad, here's what they did. Okay? And I went, you're kidding. She goes, no, they're not stupid. She didn't use those words. Matter of fact, don't quote me on that. Strike that from the record. She didn't use those words. I use those words. They pre-funded it. So that they knew that if they lost control of the House, it wouldn't be funded through appropriations. Ways and Means raises taxes in the House. Appropriations gives the money out. So part of it was already funded, and they can't not fund it. Future things, they can defund. So the goal of it was, how do we fix it incrementally if we can, and some things are coming, to change it. But the easiest way is to repeal it. That becomes harder and harder the longer it goes. So yes, it can be repealed, but you got to get people to vote. And if they don't vote, so here's what needs to happen. 51%, this isn't my statistic, 51% of small business owners didn't vote in the last election. Okay? So quit complaining if you're a small business owner and at your group you didn't vote. The second is that the religious right didn't show up either. Okay? And so if we get people to vote, just to go and show up and vote, we'll win.
I have Kaiser for my medical, and I pay $92 a month for medical. Do I have to pay more for medical?
Again, with a context, I pay $92 a month. Do I work for an employer who is providing health insurance coverage for me through Kaiser, and the portion that I pay is $92 a month? That could be the question. Or I am an individual, most likely I'm a young person, and I can pay $92 a month to buy an individual policy for my Kaiser coverage. The answer in both questions is, if you work for the employer, depends upon what that employer gets at an increase in the premium. Remember that ratio of 5 to 6 to 1 down to 3? Okay, you're probably a young person. Your rates are going to go up when your employer gets the invoice next year, the bill. Your category is going up. He may or may pass it through to you. He may not. If you're buying an individual policy, yes, it's going to, high probability it's going to go up because of that same ratio.
Is Medicare going to be replaced by Obamacare?
No. And I'm laughing at myself. Medicare is not going to go away for those 55 and above in terms of what the Paul Ryan plan, because you can't. You can't have something that people have been promised for years. When I was 30, I'm 58, I said back then, I said, look, anybody that's 40 and over back then, we should keep them in Medicare and Social Security. But if you, in 1965, there was a bunch of actuaries in D.C., and Pickford at the time, healthcare finance administrator, said, we're not going to fund this. We're not going to fund this any longer. We're going to do it on a pay-as-you-go basis versus creating funds that will be there. And the actuaries in the room hissed. There was hissing in the room because they took it off of an actuarially sound to a pay-as-you-go. So will Medicare replace? No. Will it change? It needs to in terms of how it's processed. But if I'm 67 years old today and I'm on Medicare, it's not going away because it can't, okay, in terms of the current structure, but it does need to be changed.
Okay. Your comments for dental care for seniors.
My comment for dental care for seniors. How's your polygraph? Okay, bad joke. In terms of the healthcare reform, the mandated items on employers and individuals, dental insurance and dental care is not one of the topics that's not a required benefit. In terms of how do seniors receive dental care, some of the Medicare Advantage plans you can buy dental coverage as well. If that Mary Fogelman's here, is that Mary down there? That's Mary. She's not. It's like, this is one of those questions where the rocket scientist and the chauffeur, you heard this joke before? Okay, you heard this, okay, I won't tell you the joke. But the rocket scientist gives a speech so many times that the chauffeur's heard it, and they switch roles, and the chauffeur's asked a really deep, heavy question, and he goes, that's so simple, my chauffeur can answer. And that's dental care and polygraph. So, I can't give you a qualified answer on that one.
I'm self-employed with no employees, so what's the penalty for not buying the insurance?
If you're self-employed with no employees, you have the only penalty you would have is for yourself, and it would be 1% of your income or $95 in 2014. So that would be the penalty. The penalty, and if you make $400,000 a year, 1% is $4,000. That's still less than covering your family. So you will not be, you won't be, you'll be penalized if you don't buy it, but the penalty is so small, you won't be, it's your choice.
Since Obama is taking out nearly $800 billion from Medicare, how severe will rationing be for seniors?
Well, what it will be is, in my opinion, you'll have physicians no longer and medical providers no longer taking Medicare patients. Okay? So that will mean fewer doctors treating seniors who are Medicare eligible. So by X times Y times Z, or the formula, you're going to have less providers having time, literally, to give you services, so the amount of care will decrease. They want to just, by the way, this is the statistic that I heard. We have 35,000 physicians retiring a year, and we only have 25,000 new physicians coming into the workforce. So you're going to have aging population with fewer doctors, and that's part of the concern the providers are going, we don't know how we're going to serve all these people.
Who determines preventive care?
There's something called an essential benefits that was part of the law that said there are certain items that are required by the new law for preventive care. You can do women checkups, you have men with prostate, those will be part of the covered items in your insurance plan, and there will not be a deductible or copay for it. They say, oh, it's free. Nothing is free. It's just the insured, when they receive the treatment, will not have to make a payment. Remember, the financing mechanism that will be paid either by the insurance company or by the other payor.
How does the law affect those employers with less than 25 full-time employees?
Say that again. How does the
law affect those employers?
Okay, if you have less than 25 employees, you are not going to be penalized at all for not offering a benefit plan to your employees. There is no requirement, if you have fewer than 50 employees, to offer a health insurance plan. If you're currently offering a health insurance plan and you have 25 employees or 10 or 20, that's wonderful. You're offering a great benefit to your employees for recruiting and retaining and rewarding them, but you're not going to have any penalties forced on you. However, it's 50 today, employees or more. the goal would be, as the stated goal of the people that have done the legislation is, we truly want socialized single-payer health care, but we know we can't do it all at once. So it's 50 today, they might take it to 30, to 25, to 10. It's like, you know, cancer spreads. You need to remove the cancer so it doesn't affect everything. Same thing with safe communities. You want safe communities everywhere because it spreads. Last question?
All right, we'll make this the last question. Under Obamacare, how will medical doctors and hospitals be reimbursed, and at what expense to taxpayers? At what rate or percentage of medicine will be provided, will be paid, and how will Kaiser be affected? That's one question.
Okay, let me make a general comment. Part of the law was what's called readmission rates for hospitals. Okay, and readmission rates for hospitals, in terms of Medicare reimbursements, you can get penalized. And the reason that they're saying reimbursement rates, again, it's general broad strokes for well-intended things, but you don't know what you're doing when you wrote the law. So regardless, and I was listening to a hospital, and it says, okay, I come in, I'm admitted for X, and I'm released. And I'm readmitted, not for X, but for another Y problem. I get penalized. Go, what are you talking about? It's a different problem. It's not in the law. So when you talk about Medicare reimbursements and penalties, and the reduction in the...
Americans should understand.
Hello? I heard that before, and I didn't know who it was. I thought it was God speaking. The financing of healthcare, again, remember I said Medicare already is a single-payer system. One payer, the federal government, is paying doctors and hospitals or the insurance company as a pass-through, and Medicare is not working. So the question was, how are hospital doctors going to be affected? The reimbursements are going down, and some doctors will say no more, and some hospitals go, we can't stay in business based upon the reimbursement. So there is a real problem.
All right. And I'll ask one more. So when you look at Obamacare in Massachusetts, was that a fair foretelling of what Obamacare is going to be for the whole country?
Qualified partial aspects, yes. And the reason being, but again, in the first phase of the exchanges in the state of California, the vast majority of people that will buy coverage through the individual health insurance policy exchanges will be those that are Medi-Cal and a little bit above in terms of their federal poverty level. There's those drivers, aging population, wellness, transparency, tort reform, all those types of things. That is a partial solution. The biggest solution is get people employed, because if they have a job, they can afford to buy a health insurance policy, or their employer will sponsor it for them, a portion of it. So, Romneycare, Obamacare, anything that is single-payer driven or mandated, a couple things happen. Price goes up, quality of care goes down, and the supply of your care, your product supply goes down. It's a lot of economics. You've got economic laws, political laws, and moral laws. It doesn't matter what system you're in, capitalism, communism, socialism. If you violate the laws, there are consequences that will take place. So vote and get your friends to vote, and vote the right way. Thank you.
I want to thank Joe very much. Very generous in giving. Thanks again, Joe. Really, he's been speaking. Local experts, stay tuned to the paper he's often in there. Please give him another round for all the time.